and welcome to the PrepWell series of podcasts. I'm Dr. Josh Craig, Anaesthetic Research Fellow working with PrepWell. Today, our podcast, we're going to cover exercise in the lead up to your operation. From our experiences, we know that around about half of the patients we see have some room for improvement in their levels of fitness and the amount that they exercise. So today we're going to talk to our project manager duo, who are our experts with exercise. Would you like to introduce yourself?
Hi, I'm Esther Carr. I'm a physiotherapist and project manager for the PrepWell team.
My name's Alex Nesbitt, so I'm a clinical exercise scientist that works here on the PrepWell team.
Right, Alex. As we said before, around about half the patients we see have some room to improve their fitness, but why does exercise before your operation matter?
Well, I think one way to look at it is if you compare a surgery to like a sporting event or like a marathon or like the Great North Run. Like you wouldn't go into the Great North Run the day before, no training whatsoever. So because it's an event that puts a lot of strain on your body in the same way that a surgery would. So that if we can train going into that beforehand, we can make our body a bit more resilient going in, so we're a bit more ready for the stress that's going to be put to us and more able to recover on the other side.
Okay. So you mentioned sort of it's like marathon running. What about people who can't necessarily do that type of exercise? Are there any other options?
Yeah, so basically any kind of exercise is going to be better than none. So we don't expect you to be more thorough, don't worry. So basically any kind of exercise is going to be better than none. So if we're even getting those slight fitness gains for you is going to be better, even if it's just if you can walk to the end of the street when you couldn't do that at the start of the programme. That's the sort of gains we're looking to get for you. Okay,
so we're not asking people to get really fit. What about people who aren't necessarily very mobile, if they've got sort of bad hips and knees? Are there any other options?
So what we do is we'll assess every patient that comes through so we can adapt the exercise programme to best suit you. So if you are someone who struggles getting outside, has a bit of problems with say your knees and your hips, we can give you more seated exercises so that we can still build up that sort of fitness for you and get you a bit stronger and everything like that.
Good. So how fit do people actually need to get before their operation?
I think if we can get you as fit as we possibly can, then that's great. But as long as you're fitter than when we first started, that's the kind of goal we're going for. So we're not going to push you and hammer you into the ground to try and get you as fit as possible. As long as you're just that little bit stronger, that little bit fitter from the start, it's going to give you a better chance as of your surgery, better recovery from your surgery from when you first would have started.
Okay. Are there any particular types of exercise that we think are more important before surgery?
So there's two types of exercise that we generally encourage people to take part in before surgery. So aerobic exercise or cardiovascular exercise, general fitness exercise, where you'd be moving a little bit faster, getting your heart rate up, getting your breathing rate up a little bit. We just know that prepares your body to undertake the surgery better, allows your heart to work more efficiently and your lungs to work more efficiently to get the oxygen to the tissues that you need to recover well. And the other type of exercise that we're probably not so familiar with, but strength training or resistance exercises. Because again, more recent research shows that the stronger you are before an operation, the easier the recovery is. Just things like getting up, getting out of bed when you're seen by the physio team after your surgery and they're trying to get you moving around. The stronger you are, the easier that will be for you. We do know that during any hospital admission, you tend to lose a little bit of strength just because you're not moving as you normally would do. So the stronger you are before, it just gives you a bit more reserve, a bit more resilience to be able to recover and return to normal function or possibly even better function than you are before your operation.
Okay, good. So a lot of people might wonder sort of if they've got problems and can't get around too much, how are they going to get fitter? Sort of how fit do our patients need to get before their operation?
So again, everybody's different, and we know that any improvement in your fitness before surgery can be beneficial for you. So anything that you can do is better. Obviously, the fitter we can get you, the better. But any improvements from where you are now will be a good thing.
And a common thing we often hear when we're talking to patients involved is that they're often saying, sort of, I'm fit for my age. So is that a problem, or is that a good thing that people are fit for their age?
It's always a good thing if you feel fit and you're active, then that's always good. But again, if we can make even small improvements, then yes, that will be beneficial for you. And sometimes, people might be walking, they might be doing a lot of cardiovascular exercise, but might not be doing any particular strength training, or vice versa. So there's usually some improvements we can make from a fitness point of view.
So on our sort of assessment of patients' exercise as they're coming through, what we hear often is that people say, well, I don't really have much time to do exercise, and that my operation's soon anyway. So how do we get around that?
It's a common concern for people, I think, particularly like the time in the day, and if you don't have that much time leading up to your surgery or your treatment, can you make that much gain? The answer would be yes. We would aim to help you improve your fitness, whether it's a little or a lot, whether it's 2 weeks or 2 months or 6 months that you've got to wait for your operation. We're looking to use the time that we have to give you as much of a benefit in the programme that we can, to aim to give you that better recovery on the other side. So for the day one as well, like through your day, it might just be finding ways to fit the activity in a bit differently for you. So if you're working, and you're getting the bus into work, you could walk to the next bus stop down, or if you're getting the bus into the town or the city to go your shopping, go that extra bus stop down. Just have that little bit of footfall that way. And then just in the house, I think we forget sometimes just how, when we sat down watching the TV or doing what we might be doing at home, we forget how long we sat for and how long we're sedentary for. So just being able to get up and walk around, so try and aim for, if you can get 100, 250 steps could be a goal for you each hour, certain times through the day. Just to break up how much time you are sat down for, and then it's just those little chunks you can add in through the day to help you be more active.
And another worry people often have when they're talking to the team are that they have a lot of medical problems. Is it necessarily safe for people to be exercising before the surgery?
Yeah, there's very few times when exercise wouldn't be advisable. And before we prescribe an exercise programme to anybody, they would undergo a medical assessment. And some people may even be seen face-to-face by myself or other members of the team. And we would tailor a programme to you. We've got lots of experience over the years, providing suitable exercise for people with a range of different chronic health conditions. So we will only give you exercises to do that are safe for you to do and we know you can do, and we're not going to ask you to do anything that you're not capable of doing.
Good. And you just mentioned there sort of different types of tailored exercises. What sort of options do we have?
We have a whole range of exercises, so people who are quite fit, we can work at quite a high level, right through to seated exercise programmes. It's surprising how hard you can work sat in a chair, and anything in between that really.
And do we have to go to gyms to do this, or?
No, so we've been able to offer a range of different options for people to take part in exercise, and it's really whatever works for the individual. So we have been able to offer some face-to-face classes where you can interact with us and with other people going through similar pathways to surgery. We are fortunate enough to be able to offer some live virtual classes for people who want to exercise in their own home but want a little bit of instruction and advice, maybe can't travel to the centre or are limited on time. But equally, we can provide people with a purely home-based option that, again, we can support and advise, but people can get on with under their own steam.
Good. So I think what you're saying there really is that most people coming up to surgery can benefit from increasing their fitness levels even a little bit. We're flexible, we can work around them, we've got lots of options, so we should be able to get most people doing more than they were. Do you have any sort of top tips that you can offer?
Yeah, I think it's remembering that exercise is safe. Follow the kind of guidance that we've given you. And for most people, motivation is quite a difficult thing. So finding an exercise or an activity that you enjoy doing makes it a little bit less onerous and less of a chore. And sometimes exercising with other people, so if it's safe to do so, meeting friends and going for a walk and making it a bit of a social activity as well. But equally, if you can motivate yourself and you want to exercise on your own, then that's fine. Finding what works for you and building it up over time. And if you do have any queries or come across any problems, then contacting the team for further advice would be my key message.
Okay, thank you, Esther and Alex, and this has been our podcast on exercise before surgery. Thank you for listening.